The ability to recognize with these patients that these are real visual issues and treat them is very rewarding. Many of these patients have been to many doctors, end up very depressed and very distraught. They're unable to function in their daily lives. When I go to the youth nights every Sunday, I still see the same anxieties and concerns on their faces that I had as a middle school student. By the end of the day, good old-fashioned fun and games is still a great way to build relationships.
You're listening to Wonderful Life with Tom Rohr. From Rogers to Bedford Falls, from Fayetteville to Pottersville, we're discovering how one person's life can have an effect on so many others. Our guest today is Dr. Jacob Dufour. His office uses the most advanced state-of-the-art diagnostic technology and is committed to educating their patients and providing personalized eye care services to the people of Northwest Arkansas. Welcome, Jacob.
Hi.
It's really good to have you here today.
Thanks for having me, Tom.
Hey, so our audience can get to know you a little bit better. Why don't you tell us a little bit about yourself and your family?
Yeah, so I'm 29 years old. I am a fairly local native to Northwest Arkansas. I grew up in Rogers, and I really enjoyed the local Northwest Arkansas community growing up. I enjoy going out to Beaver Lake and doing wakeboarding. I enjoy going out to Devil's Den and doing hiking, but I'm a graduate from the University of Arkansas. I went from there and graduated from optometry school in Memphis, Tennessee, from Southern College of Optometry. And through that experience, I bounced around to many parts of the country and was in different clinics on rotations in Phoenix and Virginia. And I did my residency in Seattle. And then I happily moved back home to Northwest Arkansas about 2 years ago. And it's been great ever since.
Okay. So you grew up here in the area?
Yes, sir.
And your family lives here?
I have my parents that live in town in Northwest Arkansas in Rogers still. They have the same home that I grew up in, and that's nice to go back and have some family meals from time to time. I have a sister who just graduated from Kansas University this past weekend, and she's on to bigger and better things, but not sure where. I have an older brother who lives in Tulsa, Oklahoma, and he sells life insurance with the Knights of Columbus. He has 4 beautiful children, and they're growing. So they're a good time. I get to see them pretty regularly. And then I have my oldest brother lives in Tampa, Florida, and he has 2 kiddos, and they're very, very beautiful.
Okay. Mm-hmm. So you're spread out a little bit family-wise.
Yeah, pretty spread out, but we enjoy getting together a few times a year. Most recently at my sister's graduation, we all met up, and my dad rented a house out in Lawrence, Kansas, and we had some barbecues and hang out in the backyard and good times all around.
You are an optometrist. What does an optometrist do?
Yeah, so an optometrist is a primary eye care provider. They evaluate and treat diseases of the eye and the visual system. So a lot of people hear optometrists and they think, oh, they're the guy who asked me which is better, 1 or 2, and they prescribe me glasses and contacts. That's all true, but we do a lot more. We also evaluate eye health and treat conditions like glaucoma and macular degeneration. So the field of optometry has been growing the past 30 years or so to envelop this medical aspect beyond just glasses and contacts. And so optometrists have been treating and evaluating diseases for quite a while now. So from your conditions that are blinding, like diabetic retinopathy, to conditions that are everyday, like pink eye. We see it all into my clinic, in particular in Centerton. We treat developmental and behavioral conditions of the eye, such as kids with crossed eyes or lazy eyes. We can do therapy to help train their eyes and starting to align better. And then also rehabilitative care. Patients after car accidents and strokes have a lot of functional vision disorders, like they have double vision, or they are very sensitive to visual motion and get dizzy and nauseous easily. So we work in therapy to treat those conditions as well. A lot of time when people think about vision, they think about seeing clearly, are things blurry or fuzzy, far away or up close? Am I nearsighted, farsighted? The scary word, astigmatism. So those all have to do with the refractive error of the eye, which has to do with the curvature of the cornea. However, the visual system is engaged with a lot more function apart from just seeing clearly. The visual system has to work on eye movements, so that the visual part of the brain has to plan very intricate and precise eye movements in order to do even simple tasks. So there's eye movements that are tracking, like pursuits that we use when we play sports and follow a ball. There's a different type of eye movement called saccades, and those are used when reading, and it's actually when your eye makes tiny little jumps, very rapid jumps from one spot to another. And even a non-movement or a fixation. A lot of people take that for granted, but there's a part of the brain that's in charge of making sure the eye is staying fixated on what we're trying to look at. There's a condition called nystagmus where the eyes kind of rapidly jiggle or wander back and forth and have this rapid movement or shaking that can be very disruptive. In the case of our patients that have eye turns and lazy eyes, there's nothing wrong with the eyes themselves, but actually the visual part of the brain. So in our clinic, what we really focus on is developing each area of the visual part of the brain, whether it be the part that controls eye movements, the part that controls the focusing system in the eye, how we see clearly up close, the part of the brain that turns the eyes in towards the nose. It's called convergence. It's a task that we have to do when we read, or the visual perceptual part of the brain. So many of our patients with developmental delays have issues, for instance, learning their alphabet, or even just normal kids that have trouble learning their alphabet. So the visual system is tasked with the job of taking these seemingly random lines and curves and trying to make sense out of them. So the visual part of the brain has essentially two parts. One, that it works on identifying objects and character traits. And so the visual perceptual skill of seeing these lines and shapes and identifying them as the letter A or B or C. And then the second half of the visual system is trying to process spatial information. So not only can you identify what this object is, but where is it located? So a lot of patients that have been diagnosed with a condition of dyslexia may actually have a visual spatial condition where they're unable to distinguish whether something is on the right or left side. And so that's part of what we do in our clinics, is help evaluate if these learning problems are visually related and actually due to a visual deficit instead of a learning or language deficit.
Okay. So now, do you specialize working with younger folks, or do you work with older folks, or kind of a combination of the two?
I really work with kids of all ages. I have residency training in pediatrics, treating common pediatric conditions such as strabismus or an eye turn, or amblyopia and lazy eye. I also work with kids with visually related learning problems, kids that are having trouble reading because not a language issue that they have, but because of how their eyes are moving. Kids with visual perceptual delays. A lot of children that are have larger global delays or have like cerebral palsy, for instance, they have a lot of visual perceptual issues. So they're unable to form images properly in their mind. So that can have a big impact on academics. So we work with kids with disorders like that. But then I also work a lot with adults. Those are some of my favorite patients. Is the adult population, very commonly after strokes, depending on which area of the brain is affected, there can be significant vision issues. Commonly, there's a condition called hymenopsia, and that's where one side of the visual field, the left or the right side, goes completely black. And so, as you can imagine, that's very disrupting to one's personal life. And so we work with ways to help compensate for those deficits. And in cases of visual neglect, where there's not an actual deficit in the visual field, but more a deficit in visual attention, we can help those people start to regain their full functional visual field, so they can get back to their daily lives.
So now, will a patient come to you once they're having problems? Is some of that detected in just a regular checkup?
So in our pediatric cases, we get usually referrals from whichever source. We get referrals a lot from pediatricians. who will notice the kiddos with the eye turns. There's actually some really great screening technology that has come out in more recent years that allows pediatricians to check glasses prescriptions. And so they'll refer, infants and toddlers to us to check their glasses prescription, which is quite an easy thing to do. A lot of people are concerned with how a doctor is going to check their child's eyeglasses prescription without their child being able to say which is better, one or two, or even knowing their letters for that for that sake.
Yeah. So how do you do that?
Yeah, so we use a very old technique called retinoscopy, and that's the ability for us to determine one's glasses prescription based on how light interacts in the visual system. So we shine a light essentially through your pupil into the retina, and based on how that light comes back out, we can determine which lenses neutralize the eye, aka which lenses make things clear for a person. And so we can do that very objectively. So we do that regularly with kids and even adult nonverbal patients. We see a lot of patients with autism and Down syndrome who, again, aren't going to go through your typical eye exam, and we can get just as much information from a nonverbal patient as we do your regular adult.
Oh, very interesting. Mm-hmm. Okay. So now you work in a Centerton clinic. Tell us a little bit about the clinic and the variety of services. Are the doctors there doing all the same thing, or is there some specialization?
So with Centerton Family Eyecare, it's actually meshed with a second company called Pediatric Vision Development Center. And the way this came to be is the owners of the clinic are actually husband and wife. They're a husband and wife that met in optometry school in Oklahoma. And they moved back to the Northwest Arkansas area about 10 years ago and established their own clinic out in Centerton, which honestly was very brave of them at the time because Centerton's population was not very big. The husband, Sky, he just does primary care, but he does focus his patient base in ocular disease. And so he is our go-to guy for conditions like glaucoma, macular degeneration, retinopathies of different sorts, and cataracts. So he's a very, very knowledgeable doctor in that case, in that regard. And I'm very happy to confer with him on patients that may be a little complicated.
So is he a surgeon also?
So both Dr. Sky and Megan Petty, the owners of the clinic, are both optometrists. Okay. And so his focus is more ocular disease and primary care. And then Dr. Megan, she is the owner of Pediatric Vision Development Center, two companies in one building. They wanted to make it a little more distinct because Dr. Megan only sees children, and so her focus is pediatrics. She is laid the groundwork for me to come in and work with pediatric patients with functional disorders and as well as adults, because for 10 years, she's been building a name for the clinic and educating those in the developmental field, such as occupational therapists and physical therapists, speech therapists, teachers, pediatricians, all of those who interact with children and have concern for their development, making them aware of these types of functional vision disorders so that they can be properly screened and treated.
So there's a variety of specialties within your office then.
Yeah. And so with Dr. Megan treating primarily children and Dr. Sky working mostly with adults and ocular disease patients, they brought me in 2 years ago to help build up their pediatric practice. I really enjoy working with the kiddos. Mm-hmm. And also I brought into the practice the specialty of vision rehabilitation. So that would be the care for those patients with usually some sort of acquired brain injury. So whether that be traumatic from a car accident or something cerebral vascular like a stroke, working with those patients who suffer from visual conditions and double vision, things like that.
Okay. Mm-hmm. So is the technology changing a lot in your area?
It is. It's always changing. I think in today's world, the technology is shaping most fields, and optometry for sure is not excluded from that. So Our clinic still has the classic phoropter, which is the big machine that has all the dials and lenses in it. There are some advances in that. We now can have those linked up to an iPad and fully digitized so that I can push a button on an iPad and it spins the wheels on the machine. But apart from that, it's the same mechanics inside. So nothing there has changed too much. We do have great machinery now and technology that can take pictures of the inside of the eye. So one of the best technologies we have in our clinic is called an Optomap. And that's a piece of technology that allows us to photograph the entire inside of the eye, just about the entire inside, which for most people who go to the eye clinic, they're aware with being dilated and having your vision disrupted for 3 to 4 hours after your exam. So the purpose of the dilation drops is to make the pupil larger so we can see inside of the eye and see out to the sides of the eye, which there can often be conditions such as retinal detachments that can happen in that area of the eye. Without dilation, we're unable to view and assess it. The Optomap allows us to take a photograph of that area of the eye and all areas of the eye, so that we can evaluate for disease without the inconvenience of being dilated. So a great piece of technology, something that we recently acquired, another piece of technology that's has improved patient care and especially patient convenience is we just acquired something called an eyecare. Eyecare may be one of my favorite technologies because it eliminates the need for the air puff test. I'm not sure if you've ever been to the eye doctor and they have usually have a piece of machinery that you put in your head into, and the technician will ask you to look at some picture or dot to fixate on, and then give you a countdown, and then there will be a puff of air that shoots you in the eye, and it's very disturbing to most people. So that's a machine that checks for eye pressure. It's a newer technology that's been adopted over the past 10 or 15 years to replace the more gold standard means of Goldman tonometry, in which we actually place a probe on your eye to measure eye pressure. But the eyecare system is very convenient, no eye drops and no air puffs, but it's essentially a machine that takes a very gentle reading of the eye pressure. It's very small and not very intimidating, and patients don't feel a thing. So that's a great piece of technology to have in clinic. We're really excited about that.
And they don't miss that old procedure at all.
No one comes in asking where the air puffer is.
I love it. You had to attend a lot of school to become the doctor that you've become. Tell us a little bit about that. Once you start with your studies after undergrad.
Yeah, so I graduated from the University of Arkansas and with a degree in biochemistry. Mm-hmm. From there, I went to an optometry school in Memphis that is exclusively an optometry school. A lot of optometry schools are incorporated into larger universities. The one I attended is a standalone optometry college, and that's a 4-year program. More class intensive. The first 2 years is more academics, learning not just the anatomy and physiology of the eye, but the anatomy and physiology of the whole body, and pharmacology, neurology, all of the ologies. So a good primary focus on academics the first 2 years of schooling. Your third year of optometry school is mixed both with academic classes and clinical experience. And so you are during your third year of optometry school, you are incorporated into the clinic and start evaluating and treating patients under the supervision of the staff doctors. And then the fourth year of optometry school is a clinical rotation year. So the fourth year of school, optometry students no longer take any classes, but they're invited into clinics locally around the school or around the country to learn from other doctors in different areas about how to care for patients. Okay. After optometry school, after graduating, optometrists have the option to specialize within a field through a clinical residency. So the different specialties include contact lenses, dealing with specialty contacts apart from your daily soft contact lenses that most patients wear. There's specialty contacts that help treat conditions called keratoconus, which is where the cornea starts to thin and kind of protrude forward. There's also specialty contacts that treat irregular corneas after procedures such as radial keratology. Procedures after radial keratology, which were done in the 90s as a kind of a pre-LASIK that actually has left some scarring and of the surface of the cornea a little irregular. And so it requires a different type of contact lens to smooth that over. So specialties like contact lenses. Other specialties include ocular disease, so specialized training in treating primarily glaucoma, macular degeneration, different retinopathies. Other specialties include low vision. So there's an area of optometry that treats patients that are on the verge of blindness. So patients that you've heard are quote unquote legally blind. Legal blindness just means that with one's best correction on, so with their best glasses or contacts prescription on, they still don't see clearly. And this is usually due to ocular pathology. So it can be corneal scarring, it can be a lens defect inside of the eye or retinopathy. And so those patients are considered legally blind. So low vision specializes in using devices to help magnify things so patients can function in their daily lives. The specialty I had my residency in was in pediatrics and vision therapy. And so that residency program focuses on patients with lazy eyes and eye turns. So your crossed-eyed kids and even adults, and patients with lazy eyes, meaning that one eye had a defect in it that resulted in the two eyes not working well together. And because of that, one eye becomes dominant, and the other eye becomes quote unquote lazy, meaning that the visual part of the brain for that eye didn't develop properly, and that eye will never learn to see well. Within the field of vision therapy, we also treat functional vision disorders. We target eye movement disorders. So again, children who have trouble reading, part of our job in vision therapy is to evaluate whether the deficit in reading is due to a vision problem in acquiring the text properly and moving their eyes efficiently and processing that visual information before it's sent to the language and auditory centers in the brain for processing, making sure that there's no deficits there. And then so my residency was actually two-part. Half of my patient base was the pediatric developmental and functional disorders. The other half was adult head trauma and acquired brain injury, working closely with patients who have visual field loss after stroke, patients who have double vision, again, usually after stroke or head trauma, the two eyes don't align properly. And so you have an eye that's slightly higher than another, or an eye that's turned in or turned out. And if the eyes aren't working well together and pointing at the same spot, we see two of everything. That can be very disruptive to one's life. So I really enjoy working with my double vision patients, as well as more subtle changes. So frequently after concussions and car accidents, patients have vision disorders that are a little more subtle but very, very devastating. So commonly head trauma patients have very, very high sensitivities to light, especially fluorescent lights. Patients have an aversion to near work, so their eyes don't work very efficiently when things are up close. So they don't like turning their eyes in towards the nose, which is something that must be done when we're reading or working up close. These patients are also very, very sensitive to visual motion. So for instance, during my residency in Seattle, which as we know is quite the rainy city, several of my head trauma patients wouldn't be able to drive, largely because the movement of the windshield wipers while they were driving was too aggravating. But this is extended to, I had a patient who was an accountant and was unable to work at her computer because as she was scrolling down the screen, that little visual movement made her very disoriented, dizzy, and nauseous. So the ability to help assess and recognize with these patients that these are real visual issues and treat them is very rewarding. Many of these patients have been to many doctors, some neurologists and some primary care doctors after their head trauma, and try to explain these deficits to these doctors who are maybe less familiar with these types of conditions and how to treat them. So a lot of these patients end up very depressed and very distraught. They're unable to function in their daily lives. Most patients get severe anxiety and find difficulty going to something as simple as going to the grocery store, which you and I maybe take for granted, but visually is an incredibly busy environment. So there's lots of movement, there's lots of visual stimulation, and for patients after head traumas, this can be very disrupting.
Yeah. Well, and as you're talking about all this, I'm just thinking about, gosh, how important our eyes are for us. And, when it's not right, it can be very disruptive to our lives. Mm-hmm. So if we had a listener out there right now that was struggling with some aspect with their eyes, what's the best way for them to, get a hold of you, or should they start with their general doctor, or what's a typical process when somebody is maybe just now struggling with their with the function of their eyes?
Any concerns with your visual system should properly be evaluated by an optometric physician or an optometrist or an ophthalmologist who are the eye surgeons in our field. So a comprehensive exam by an optometrist or ophthalmologist and a discussion about your complaints in particular would be a really good start. If the optometrist or ophthalmologist feels that that vision disorder is outside of their scope of primary care or whichever specialty they're in, they'll make the proper referral to a behavioral optometrist who will assess and treat the problem accordingly.
Okay. Yeah. And again, our eyes are just super important, and we need to take care of them.
Mm-hmm. So our big focus is not just eye health, especially in Centerton Family Eyecare. We hold ocular health extremely important, but more importantly, we evaluate the visual part of the brain. So not just what the eyes are doing and their health and the clarity of the signal sent from the eye, but how that visual information is received in the back part of the brain where the visual centers are located, how that visual information is received and processed. Many of these patients, for instance, are kiddos with the eye turns and crossed eyes. That's not an issue with any of the eye muscles or how the nerves that are controlling those muscles, but actually the visual part of the brain, the part of the brain that's supposed to coordinate the two eyes together.
Okay. Well, and so the problems that we're having with our sight might be based on something that's located back in the brain somewhere.
Absolutely. Nearly the whole back half of the brain is processing visual information, and studies have shown that nearly 80% of the brain has visual information being processed in it. So that's why generalized head traumas like car accidents can result in so many significant visual issues, is because so much of the brain is involved with vision.
Very good. Yeah. Well, Jacob, we will have your contact information in the show notes. So, if you're out there listening right now and struggling, or someone in your family struggling, we encourage you not to wait, but to get a hold of Jacob and folks in his office.
Absolutely. We see patients all the time who come in and they have a kid with an eye turn, and they're there to have their kid assessed on whether they should do vision therapy to help treat the eye turn or potentially have surgery. And I see that the parent also has an eye turn, and so I started a discussion with them about treating it. And many people believe that once that they're adult, these kind of conditions can no longer be treated. And there was many studies that were done in the past that had indicated that these type of neurological vision disorders of crossed eyes and lazy eyes were no longer treatable after the age of 6. And then more studies came out showing, well, maybe it's extended to maybe the age of 10 or 12. And then more studies and more research was done and found out that these conditions could be treated up to 16 or 18. And it's grown to the point where nowadays we don't have a limit on it. Many people say that the limit is when you're in the grave. Okay. So we see plenty of adults that have maybe lived with an eye turn or a vision issue their whole lives and have kind of put away thoughts of treating it or that ever being fixed. But some of my favorite patients are those that have these troubles, have had them their whole lives as adults, and haven't given them the ability to fix their visual problem and regain confidence. Actually, that was just the case with my one of my friends, Daniel. He's a good buddy of mine that we get together and play board games and music regularly, and I'm very close with his family. After about 6 months of his and I friendship, his wife came up to me and she has a little bit of an eye turn, and she, in private, because it's something that she was very self-conscious about. As a kid, she was ridiculed even by family members. She told me that her uncle used to give her a hard time and call her 8-ball because it looked like her 8-ball was in the corner pocket because her eye turned in so far. And so this is something that she grew up very self-conscious of, and now she's in her mid-30s, and she privately took me aside and asked me if there was a way to treat, and I said, absolutely, that's what I do. And so we're starting to work with her and helping her align her eyes to give her a little more confidence there.
Mm-hmm. Oh, great.
Mm-hmm.
Well, all right. So, Jacob, we're going to pivot a little bit too.
Okay.
All right. So you're also involved in youth ministry. So what ages of youth do you work with, and what's your level of engagement?
I really enjoy working in youth ministry at my church. I was started being involved with the middle school youth group even when I was in high school. At the time, they had high school students come on Wednesday nights and help the adults with youth ministry for the middle school age kids, grades 6 through 8. And in high school, I found that very rewarding, and I continued doing that through college and beyond. So it's been about 10 years now that I've been working with middle school kids in the youth group, so grades 6 through 8.
Yeah, so you've got a lot of experience.
Oh, maybe
10 years.
Maybe a lot of experience of being a kid, but
you don't want to quite let that go. Well, now do you find that the kids are much different now than they were, say, 10 years ago when you were a part of that group?
Of course they are and they aren't. Of course, there's the advances and changes in technology. So every middle school kid now has a cell phone, and they have social media accounts on social media platforms that I'm not even aware of. But the true nature of a middle school student, I don't think has changed too much. So when I go to the youth nights every Sunday, I still see the same anxieties and concerns on their faces that I had as a middle school student. They're still primarily concerned about social interaction and fitting in. Are they cool? Who's better at what sport and who likes who? So it's all the same concerns, just wrapped up in a little bit fancier technology. So in that way, I find that the middle school youth are still very relatable.
Okay. Well, now, could you share us a couple stories with us, and maybe some of your favorite engagements that you've had with while you're working with the youth?
Every year, our youth group does an event called Woodser, and that's where we go out on one of our parishioners has several hundred acres out of woodland property, and he's gracious enough every year to let us go out there and take about 120 kids down his dirt trails and pastures to do bonfires and have talks and games and activities, food, snacks. That's a good time for everyone. Everyone really enjoys being outdoors. We usually do it in the fall, so it's a little bit chilly, and so we like having the bonfire, and we do a hay ride. The talks are usually incredible. We have several adults within our parish that do about 4 or 5 talks over the evening, and then by around 11 o'clock, when it gets too cold to bear anymore, we bus them back to the church. And so that's been fun. There's a different theme every year. Past year was superheroes, of course, and so the kids really had a good time with that. Other trips that we've done with youth ministry include a summer camp through the company Life Teen. So they put on a summer camp in Georgia called Hidden Lake. And it's extremely well done. The Life Teen company does an absolutely phenomenal job creating a new age environment for the kids to come into, and a very Christian and Catholic environment that's very immersive. So it's first class all around. They bring in professional musicians and have proper lighting and sound equipment. And so each time you go to a talk, there's some music that is at Hidden Lake. They do a phenomenal job bringing in professional musicians, professional sound and lighting technology.
Is that life changing, or is it introspective, or?
It's both. So apart from the facility, which is kind of tucked away in the mountains of northern Georgia, it's a great environment, and they bring in college students that actually volunteer as their leaders, the small group leaders for the entire week, who they have donated their own time. So they're not getting paid, and it's not a scholarship program, but these college students go through a pretty thorough vetting process. It's a very sought after position to spend their summer to help evangelize to these students. So they have phenomenal leaders there at Hidden Lake, and they also bring in very good speakers to come in that are very relatable and enthusiastic about their Christian life.
Good. So now you're getting to the end of a year now of youth ministry. When you look back, what's success look like? Yeah,
so we just wrapped up last Sunday with our last Life Night or Edge Night. I thought it was a highly successful year. So in the past, I found one of the limiting factors with our youth group is that the students are not very comfortable with each other. So in our small groups, discussions were very limited, and I found kids were not really engaging with, anyone apart from their 2 or 3 friends that they might know there. And so I discussed with our youth group leader this year about spending a good amount of the first semester really focused on team building. And so what we did is we did a whole series of games for about the first few months that really focused on team building within the small group. So we have them divided up by grade and gender. So we have 6th, 7th, and 8th grade boys and 6th, 7th, 8th grade girls. And in those small groups, they competed against each other in teams during various challenges and events to score points over the whole semester, which actually climaxed at our Woods retreat was actually our final game competition for that. The beginning of the semester, we really focused on team building. I think that went really well. That allowed the rest of the semester to be more discussion driven. Kids were much more comfortable with each other and with sharing, and allowed us to just go a little deeper with their spiritual life.
Well, and it's so hard. It's so hard today because it's so easy to communicate in a nonverbal way. It sounds like you got them to be working with each other and communicating face to face with each other.
Absolutely. And maybe that was part of the challenge, or maybe it's always been the case. But for the kids now that primarily interact electronically through social media, maybe some of those social interaction skills are not well developed. But by the end of the day, good old fashioned fun and games is still a great way to build relationships. And so we're really happy we implemented that this year.
Yeah, I agree. I'm sure it offers those kids a nice balance, and they understand what that's like, and probably crave more of that because of their experience. Mm-hmm. Very good. Well, Jacob, are you ready for our lightning round?
Oh, I don't know.
I've got 3 random questions for you today.
Okay.
And they're pretty random. All right. If you could be any animal in the world, what animal would you be and why?
Am I allowed to choose extinct animals?
Absolutely. Absolutely. We'll bring them back.
Great. Awesome. I think it would be wonderful to be a pterodactyl because I think it would be amazing to fly. I've always wanted to fly as a kid. That would be like the one superpower I wish I had was flying. I think the rush of soaring through the air would be fabulous. But then I also didn't want to be a bird that would be susceptible to getting preyed upon. So I think the pterodactyl was a pretty aggressive creature back in the day and a force to be reckoned with. So I think that would be a lot of fun. But I guess there was some pretty scary stuff back at that time too.
I wouldn't want to mess with the pterodactyl for sure. All right, second question. What would we find you doing on a day when you're not at work?
My days off, I'm usually hanging out with good friends. One of my favorite activities with friends is playing instruments. So I have picked up a few instruments along the years, from mandolin to banjo, ukulele, bass guitar, and hopefully soon to be cello. I really enjoy music, and I enjoy playing music with my friends. My good buddy Daniel is lucky enough to have a bonus room in his house that over the past few years we've filled up with just about every instrument imaginable. We have keyboards and drum sets and violins, and we're starting to work on getting a brass section too. I was looking at trumpets on Craigslist the other day. But I really enjoy music. I'm not sure I find anything more rewarding than just relaxing and playing music with my friends. We're also really into board games. We have a group that gets together every month or so, a group of about 6 or 8 of us that will come together and play some strategy board games. Actually, this weekend.
What are your favorite games?
Oh, that's a good question. So there's some great strategy games out there, and the market is really growing. Board games is becoming a very popular hobby for many. And some of my favorites, I guess some of the more easier ones to get into, I would have to endorse King of Tokyo. Is a super fun game for about a group of 4 or 5. If we're a little more intense and want to try some one-on-one strategy games, there's a great Lord of the Rings themed game called War of the Ring, and it's essentially the whole Lord of the Rings movie played out in a 2-player game. One player is the Fellowship and Frodo and Sam, and the other person is the Shadow character, that's Sauron and Saruman. It's about a 4 or 5 hour game that's very heavy in strategy, but it's a great time every time you play, especially if you have a connection with the movie and the books.
And I heard someone talking about a game it sounds similar to that, and it was Star Wars theme. And you had one person was the bad person, but everybody else was a place. You had a place and a character within Star Wars.
Oh wow, yeah.
And anyway, the person that was talking about it liked to be the bad guy there. They had a lot of power and they can really mess with you.
That sounds like my brother. That's the type of characters he likes to play.
So it was like 1 on 5, but if you were the one, you really could mess with the other 5. So that's very interesting.
Yeah, I'll have to get the name of that game after this.
That sounds like a lot of fun. All right, last question. Mountain chalet or seaside resort?
I think that's an easy one. Mountain chalet, 100%. That is something that I've really enjoyed since about high school, as I found my love for mountains. I like to be outdoors. I love hiking and kayaking, but there's nothing that I like more than having a good mountain view. So whether that be driving down the interstate up here in Northwest Arkansas on 49 and looking at the great views and scenic vistas that we have there, or going out to Beaver Lake and seeing what little mountains there are, but just that dynamic terrain I find really breathtaking.
Yeah, it is a mountain. Well, Jacob, we appreciate your time today and joining us for the show.
Of course.
And thank you for tuning in to Wonderful Life. Remember, the only thing that you can take with you is that which you give away. This is Tom Rohr, the richest man in town, signing off till next time.
This is the Padua Podcast Network. PaduaMedia.com.